Hi.
Hi, do you mind if we come in?
Yeah, of course, come on in.
I'm up here. I'm intern with HDR UK. You kind of look familiar. Have we met before?
So I'm Dr Michaela James. I'm a research officer that collaborates with Health Data Research UK. So that might be where you know me from.
That must be where I know you from.
There we go.
Did you have a meeting in here?
No, I actually just came up here to work so that I could look at these really beautiful views of Swansea.
Yeah, the weather is not doing it justice, but I'll take your word for it.
Oh yeah, please take my word for it. It's not always this great.
So since you've had a bit of work with HDR UK, do you mind if we ask you a few questions?
Of course, fire away.
Cool. So, what was the first thing you did after waking up this morning?
The first thing I did when I woke up this morning was obviously looked at this beautiful weather. And then I had a cup of coffee, let my dog out, and yeah, started to plan my day, I guess.
Nice. Well, it's morning, but what do you like to do before you go to sleep?
Before I go to sleep, I normally like decompress with something on the TV, but it has to be super lighthearted, otherwise I get too much anxiety and I won't ever go to sleep. But yeah, normally try and read a book and be good, and then I try and decompress with like something that I watch all the time, so it'd be like The Office US or something like that, yeah.
Cool. Tea or coffee?
Oh my god, coffee! Coffee.
Okay, well, what's something people always get wrong about where you're from?
So I'm from beautiful Wales. Well, I live in Wales now. Everyone thinks that it's like the famous quote, which is pretty something city, but actually it's a really beautiful place. The sea is actually over there, but you can't see it through the tree line at the moment. But yeah, the sea is here. And yeah, I think the misconception is that everyone thinks it's like not great, but like literally 15 minutes away, it's the most beautiful place in the world.
I'll take your word for it. 24 hours in Swansea, where should I go?
The Gower, yeah, 100%. Go down the Gower, go to one of the incredible beaches. So 3 cliffs, and there's also some really amazing like hidden beaches. So we like to go to Slade, you have to go down on a little rope, on a little track. But yeah, head into the Gower, that's my #1 piece of advice.
If you could keep one Welsh word in your vocabulary, what would it be?
So there's a word, I'm going to butcher it though. Okay, so cariad, which means to love, but it's like love, like deep love. Cwtch, I'm naming just words now, but cwtch is like hug, like a really big hug with like loads of love, so probably that one. There's also a word for like belonging and home, but I can't remember that, so just cut that bit out because I can't remember what that word is. Maybe we'll do that again.
That's okay. Outside of academia, what's a skill you'd love to master?
Skateboarding,
Nice.
100%.
Michaela, just a bit about your work and your research. So firstly, what kind of health data are you most interested in?
So anything to do with children's health and wellbeing. So we collect lots of data around children's self-reported health and wellbeing. So that might be outcomes related to physical activity, sedentary behaviour, diet and dental health, mental health and wellbeing generally. And then we create this cohort. So I'm funded by Administrative Data Research Wales. And then that's how we collaborate with Health Data Research Wales then as well, is that we're able to then share that data so that lots of people can use it, so that we allow that self-reported data to be used by multiple people, you know, looking at what's available in the HDR gateway and being able to like link that with different outcomes so that we can build a much wider picture of children's health and wellbeing and not just in the self-reported outcomes that we've got then as well.
Nice. Cool. So how do you use health data in your research?
So we use it to answer some of like the biggest questions at the moment. So basically, my research looks like this whiteboard. So it's a very blank slate. We then co-produce a lot of our priorities and engage with the public around what we should be researching. So we'll ask children and young people, we'll ask teachers, we'll ask key stakeholders to make sure that we're answering some of the best questions that need to be answered right now. So our priorities are currently looking at things like screen time, they're looking at free school meals, and they're looking at additional learning needs support in Wales. So anything that can kind of link with that, then yeah, that's what we're trying to look at.
Wow, that's really cool. But what actually inspired you to focus on young people's well-being?
I have been involved in children's well-being for a lot of my time existing in this planet. But basically, I started off coaching children and young people and then realising like what are the influences around their well-being. And then as I kind of progressed into a research career then looking at how do you implement or how do you allow them to have a voice in that. So then being able to let them have a say on the research and let them have a say on what's important to them. So that's why a lot of our research is self-reported outcomes, because it gives children and young people an opportunity to really have a say on what influences them or what is important to them and how they're currently feeling.
Nice. Okay, still on young people, what's the weirdest thing a child has said to you during your research?
I never thought I would use the phrase dog poo more in my life than when I'm talking with children and young people. So basically, children and young people tell us all the time that it's a massive barrier to them playing in parks, it's a massive barrier to them using the community. So yeah, I use that phrase loads more than I ever thought I would, especially at conferences when you're sat in front of other academics, having to use the phrase dog poo.
Okay then, well, what's your favourite way of making research fun for young people?
So being able to do it in really engaging ways. So basically being able to make it super accessible so that we can involve them in right from the start all the way up to the kind of the dissemination. So being able to have them involved in making the research questions, being able to help them help us design the research, but being able to make it so that children and young people are not just involved in telling us, but they can also help collect the data. They can help, really actively be involved in that research process.
Oh, that's really cool. Makes me want to be involved. Well, what's one thing you would love to see happen as a result of your research?
I would love to see children and young people's voices much more embedded into research. So, using the United Nations Conventions on the Rights of the Child, Article 12, much more heavily in research so that they're really being able to have an opportunity to have a voice and being able to have a say on matters that affect children and young people.
Mm-hmm. What's one question we still aren't asking young people?
How can we involve you? I think that's the biggest question we need to ask children and young people. Like, how can we involve you in meaningful ways? How can we make research meaningful for you? How can we make it so that you feel valued as part of the research process and so that it's not tokenistic? So, how does that make it meaningful for you? How can we, what ways can we do that? So it's not so time intensive for them, but we're getting the most out of, being able to have children and young people embedded in that.
Mm. And who's one scientist you'd love to work with, dead or alive?
Mary Anning, for sure. So Mary Anning is a paleontologist. She was a pioneer for women in STEM. But I would love to be able to work with Mary Anning for various reasons. But I think she's one of the coolest people on earth.
Nice.
So, yeah.
Okay, and what's a risk you've taken in your work that really paid off?
Working with children and young people. So I think, having them have a say, I think is quite scary for lots of different people. I think there are lots of funders, lots of other academics that think giving children that autonomy can come up with a wild variety of responses and sometimes answers that we don't want to hear. But I think that's really important. So I would perceive that I don't think it's a risk. I think it's something that is a necessity, but I can see how other people would interpret that as a bit of a risk.
Mm-hmm. Okay, and what does ethical health data science mean to you?
Ethical health data science means involving people and populations that are involved in the research. So ethical means having everyone that should be at the table in really meaningful ways.
Okay, Michaela, I want to know about some of your favourite things. So, favourite song to walk to work with?
So this morning I walked to work with Touche More. I've recorded some Maida Vale studio sessions. So I've been listening to those. But yeah, anything that makes me feel like a badass is normally what I try and listen to.
Nice. Favourite book to recommend?
Favourite book? So my friend Kerry is a book talker and she gives me books all the time. So I actually am not the book recommender. I just have book recommendations from her. And honestly, anything she recommends, go follow her on TikTok. That's a shameless plug for my friend's TikTok account.
Fair enough. Favourite Welsh food or treat?
Favourite Welsh food? I'm vegan, so loads of Welsh food I can't eat. When I wasn't vegan, it would be Joe's ice cream. If you've never had Joe's ice cream from Mumbles, you need to have the strawberry marshmallow sundae.
Nice.
Yeah.
Okay, if you could be on any TV show, what would it be?
Any TV show, The Office US. Oh, yeah, like I would just do my job surrounded by those people. Yeah.
Fair enough. If you could spend a day with anyone, living or dead, who would it be?
Okay, I'm going to go back to my first answer, Mary Anning. So I would just go around with her and her dog and just dig for stuff. That's actually like my ideal life. Being outside, being muddy and finding dinosaur fossils. Yeah.
Love that for you. What's your vice?
My vice? What does vice mean? Is this an outtake now?
No? Like, kind of like a guilty pleasure, like something that you always go towards, like your comfort. So
my guilty pleasure is like trash TV, so Below Deck. I'm really ashamed to admit that, but yeah, Below Deck, that's my vice.
Okay, and what's one thing you must have in your office or workspace?
Access to coffee. Access to coffee, yeah, there we go. That's it.
So, true or false? you've had a research idea while you're in the shower.
True. Yes. I think some of my best thoughts come from while I'm in the shower.
Nice. Don't they all? You sometimes dance around the kitchen.
No, I'm not a dancer. I mean, I'm the most socially awkward human of all time. Like, if I could avoid ever dancing in front of people, including myself, I would never dance again.
Okay. You've Googled your own paper to check the citation count.
Oh my God, I did it this morning. No, I didn't do this one. Someone sent me a link to my conversation article and I was like, oh, and then it turns out I was really proud of myself, basically. I did it for a pride point of view, not to, but yes, I have.
Fair enough.
If anyone says no, they're lying.
Okay, and TikTok trends have influenced research topics.
Oh, I don't necessarily think TikTok trends have, but I definitely think TikTok has. I think lots of people, we're seeing it loads at the moment around the implications on screen time and how children and young people are accessing screens and information. So I don't necessarily think the trends have, but I definitely think TikTok itself has influenced. And I think that's come with a lot of preconceived notions of what it is and how it's being used.
Cool. Okay, so what's the biggest, most positive change you're seeing in health research today?
I'm co-production. So I think I'm seeing lots of people using co-production in really good and effective ways. So I think that's the biggest, kind of most effective thing that's being done right now.
Okay, and if you could tell 21-year-old Michaela one thing, what would it be?
I've actually got a few things. I think about this quite a lot. So the first thing would be to find your voice, find whatever makes you feel like you can use your voice and speak up loudly and say how you feel about certain things. The other one would be to make space, not just for yourself, but for other people. And the other one would be your own brand. So just be authentic. So those three things.
I think we can all take on that advice. And okay, last question. What's one thing you hope people take away from your work?
I hope people take away how important young people can be to the decision-making process. I hope they realise how much young people have value, how much they can contribute, and how much, if we actually put the power into young people's hands, how much of a better society we would exist in. Because lots of the stuff that children and young people suggest are the most cost-effective, simple solutions to some of our biggest problems. So if we did that, I think you'd find a lot of stuff was quite easily solved. Yeah.
Wow. Thank you so much, Michaela, for your time today.
Oh, you're so welcome.
I'll let you get on with your day. Have a good day.
Thank you so much.
Bye.